In this image, we see the stomach meridian next to what is known as the superficial front line in myofascial anatomy. Now, one advantage of knowing the anatomy of these lines is that we can determine exactly what muscles are on which meridian or on which fascial line and how that relates to the other muscles that are on that line as well. So we can see that a point like stomach 36 is located in the tibialis anterior muscle, which is a part of the superficial front line. Now, stomach 36 is widely known for treating gastrointestinal conditions, as well as lung and even heart conditions as well. So if we follow this line up, then we can see that the rectus abdominis muscle is a part of the superficial front line. And we should remember that on the interior side of this, many of the viscera are going to have fascial connections or connections through the ligaments to the internal side of the abdominal wall. So this can explain a mechanical basis for how a point like stomach 36 can affect the internal abdominal organs. Now, similarly, stomach 36 is also known to treat a variety of lung and heart disorders. One thing that we should observe in relation to the lungs is that the SCM is also a part of the superficial front line, and it's a secondary respiratory muscle. Now, we also have the sternalis muscle that's a part of the superficial front line running along the length of the sternum, and then the fascia that connects to the sternum is a part of the superficial front line as well. So when we needle a point like stomach 36, then through chi propagation or through mechanical forces and through mechanical force transmission, we're going to be able to have an effect on the sternum. Now, underneath that, we do have those connective tissue relationships between the lungs and even to the pericardium as well, because there's pericardial ligaments that move to connect into the sternum. So by understanding these myofascial lines and what muscles and what points are on these lines, we can start to develop a better basis for understanding how acupuncture can affect distant areas of the body, because we do notice in traditional ways of thinking, as well as in a modern scientific way of thinking, that when we insert an acupuncture needle, it's going to cause chi propagation, as well as changes in the mechanical forces and in the connective tissues.